Hi, my name is Nathaniel Scott, and today I'm going to be presenting my evidence-based project. I'm a student at Grand Canyon University. So imagine walking into a dialysis clinic where the nurses look drained, worn out from long hours, high patient workloads, and a nonstop stress. Now think about how that kind of exhaustion affects the care of patients and the care that they receive. Burnout isn't just a personal problem, it impacts the entire system, from the patient to safety, job satisfaction. At Pennsylvania Dialysis, we saw how serious this issue was, and we asked the important question: what if we could help nurses build resilience to aid them in feeling supported again? Today, I will share a solution that does just that: a structured evidence-based resilience training program that's designed to reduce burnout, improve job satisfaction, to lead to better patient outcomes. Let's drive and see how it works. Nurse burnout is widespread in dialysis centers, leading to high employee turnover and low patient outcomes. The Peacock question, which was the original, focused on original dialysis nurses at Fresenius Medical Care, experience signs of burnout. How does implementing a mindful stress reduction intervention compared to formal resilience training impact burnout levels, job satisfaction, and turnover rates within 112 to 180 days? That revised PCOT is this: dialysis nurses at Pennsylvania Dialysis Care experience burnout. What is the effect of structured resilience training program or burnout level, job satisfaction, and turnover rates compared with no resilience training within 6 months? From the background study and the literature review, all the information that was gathered was nurse burnout negatively affects nurses. It also impacts patients. The mindfulness study for the interventions really decreases the emotional exhaustion of our nurses, and studies highlight resilience in the training program for a positive impact on outcomes. The proposed solution focuses on two things: cognitive behavior therapy, otherwise known as CBT, and guided meditation. That would be done twice weekly to enhance emotional regulation. The monthly CBT workshop addresses stress and coping mechanisms. The intervention improves both nurse well-being and patient outcomes. Success for any program will rely on several things. One, making sure you have great stakeholder engagement. We have to have dialysis nurses for our primary target groups and dialysis nurses that really are going to believe in the program. We have to have nurse leaderships that are going to ensure that there's some alignment and support. We have to have patients that are going to be benefiting from the program due to the outcomes that it'll see. The organizational leaders will oversee the program and the implementation, and we'll have joint commissions and CMS monitor the quality of compliance. Within the change model, there are several things that are important, but one of the important things is the nursing leadership will be important to embrace the change model for its success. Partly of it is the knowledge within this stage will create awareness for the resilience program. Their ability to have some persuasion in this stage is important, as this stage will emphasize the support of the stakeholders. That is in the decision stage, this will involve allocating resources and scheduling sessions for the nurses that are actually going to be in the program. And then in the implementation side, there will be some confirmations to assess the program for the success and the sustainability of the program, which will be from the stakeholders. For evaluation methods, we're using a mixed methods approach, which combines quantitative and qualitative data. By combining both of these data principles, it will allow us to assess the burnout of our nurses and against our patient scores. Burnout assessments, we're going to use the MOSH and Wright from 2021. And then we're going to utilize focus groups with nurses, which will allow us to collect that quantitative and qualitative data and tell us about their opinions and their experiences within the program. For the implementation phase, which is phase one, we will focus on a plan that focuses on establishing strong foundational for resilience program. The baseline data will be collected to assess the current levels of nurse burnout and satisfaction and turnover rates using validated tools such as the Moss Burnout Inventory, the Job Satisfaction Survey, and the Turnover Intention Scale. This will serve as a benchmark against which post-invention and the results will be measured. And this is from Walsharks 2022. This program will be introduced to important stakeholders, especially the nursing leaders. This is very important, especially for the nurse leaders, and the team will start looking for the staff to train for the resilience program. This will allow for the business to stay ready for an effective intervention and implementation. Phase two, the implementation page. This plan involves the delivery of a structured resilience program, twice a week meditation sessions facilitated by trained professionals, and a monthly CBT workshop reviewed and presented by trained professionals. The role will include facilitators to lead meditation sessions, mental health specialists to run CBT workshops, and those with administrative support will manage the logistics, maintain participation, tracking, and scheduling. That's Zhang 2021. This allows for real-time adjustments based on participation, feedback, and engagement levels for regular monitoring, Lido 2004. It allows flexibility of customization of the program and will be implemented to ensure effectively it fills the gaps of the staff and keep high engagement. Post-implementation. The pre and post-implementation will be compared with the intervention data and burnout satisfaction and turnover. Focus groups will evaluate the program's effectiveness and help guide future adjustments. Expected outcomes and goals. Target goals include a 20% reduction in burnout, 15% increase in job satisfaction, and 25% reduction in turnover, and 10% improvement in patient satisfaction. Barriers to implementation. Scheduling conflicts among nurses may hinder participation. With skepticism, limited funding, solutions involved with leadership support, flexible implementation, and communicating long-term value of the program. Sustainability and future directions. Sustainability and future directions, a train the trainer model will ensure long-term continuity. The future will be embedded in the organizational culture, and future research will assess the expansion of the program in all departments. In conclusion, burnout affects both nurses and patients. Proactively addressing it thoroughly, resilience training can improve staff well-being and care of the quality of patients. This project demonstrates the importance of evidence-based sustainable strategies in healthcare improvement.